What if everything we've been told about autoimmunity is wrong? I'm Elizabeth Yarnell. After awakening partially blind one morning in 1999, a doctor told me my multiple sclerosis would put me in a wheelchair within 10 years. I refused to accept that as the end of the story, so I started investigating. Welcome to the Inflammation Investigator, the podcast that uncovers the inflammation lurking underneath your ailments. Because autoimmune and chronic conditions should not be viewed as death knells when they are actually alarm bells. I'm a traditional naturopath and founder of the Inflammation Academy. And in 2 episodes every week, we dig into what conventional medicine might be missing. If you're living with chronic or unexplained symptoms, this investigation is for you. Your body has been trying to tell you something. Let's start listening. Welcome back to the Inflammation Investigator. My guest today is going to talk about some things that we haven't really talked about before, and I'm going to just tease it a little bit with saying we're going to talk about some of the stuff about aging and inflammation. So Cynthia Thurlow is a nurse practitioner. She's the host of Everyday Wellness podcast, and she's also an author and an international speaker with over 15 million views for her second TEDx talk, which is about intermittent fasting and a transformational technique. With over 25 years of experience in health and wellness, Cynthia is a globally recognized expert in perimenopause, menopause, and intermittent fasting, and has been featured on ABC, Fox 5, KTLA, CW, Medium, Entrepreneur, and The Megyn Kelly Show. See if I can not trip over my tongue today. Her mission is to help empower women to live their most optimal lives in perimenopause. Oh, I am tripping over my tongue today and beyond. But Cynthia, welcome to the podcast.
Thanks for having me, Elizabeth. Looking forward to having this discussion today.
Me too. So how'd you get into this? Not, of course, into the menopause thing, as we all end up there, but how did you get into looking into it more deeply?
Well, I think that, to kind of back up and give listeners some context, I spent 20 years working in traditional allopathic medicine, both in ER medicine and cardiology until I got tired of writing prescriptions. That's the easiest way to explain it. And so for the last 10 years, I've been myopically focused on women in midlife. And I really start the book off, The Menopause Gut, talking about this romantic trip to Morocco that I took with my husband in 2018 to celebrate our 15th wedding anniversary, and how we ate the same food and did the same things. And one of us got sick and the other one did not. And so it's really speaking to how our microbiome and our immune system and our hormones, as they are changing, it just makes us more susceptible to opportunistic infections. In my case, it ended up landing me in the hospital for 13 days, which preceded that TED talk that you were kind of alluding to. But from a very kind of macro level, as I have a podcast of my own and I get to interview incredible experts and clinicians, it just became more and more apparent to me that these conversations around aging in women were more than just focusing on brain, bone, and heart health, that there really was a larger conversation which was not being had that really speaks to how our aging is this. I call it the unwinding of our immune system, but inflammaging and immunosenescence, which is the technical term, is really at the basis for every chronic disease that we see in the United States and abroad. And why I think it's really important for women just to build awareness on what are the things they can be doing earlier. So for listeners that are in their 30s and 40s, what are the things you can be doing to help prevent or lessen the likelihood you're going to experience as much inflammation as many of your older counterparts have or are experiencing, and how we can kind of turn things around for the microbiome. I'll make the argument that every single person listening needs to understand that the gut microbiome interfaces with every single organ system and cell in the body. So there's a gut brain axis, there's a gut bone axis, there's a gut ovarian axis that impacts when we go into menopause. Those kinds of insights are unique and different. And so I was able to unpack all the research around this and really make it a kind of a joyful experience of talking about what's changing and then proactively how do we address it without anyone feeling any shame or secrecy or feeling like they have to do a laundry list of things. Because I know for my patients, if they have 20 things they need to do, they're much less likely to take action than if I give them one or two key things to focus on at a time.
That's such a good point. And for listeners who are watching this visually, you can see Cynthia's book behind her that's coming out just a few days after this podcast episode is going to be released in April of 2026. So if you can see it, you can see it. But if you can't see it, it's called the menopause gut. And I don't think I've seen the connection between the gut and menopause really explored like this before. Tell us a little bit about what you found connects the gut with menopause so clearly.
Yeah, so let's at least define the gut microbiome so people understand it's kind of an invisible organ system. So it's 40 trillion bacteria, viruses, fungi, and protozoa that are incorporated in the large intestine or colon. And it's heavily imprinted by whether or not we're a vaginal delivery, whether we're a C-section, whether we are bottle fed with formula or breastfed. We get these unique imprints throughout our trajectory of our lives. First, again, with puberty, not surprisingly, young men and young women get some differentiation in their microbiome vis-a-vis different types of hormones, pregnancy, if we choose to become pregnant, and then perimenopause. And the irony is our microbiomes start to resemble men's in menopause, but that's not to our advantage. Let me be very clear. But the dynamic microbiome, understanding that there's this gut ovarian axis. So our ovaries are the most mitochondrial dense organ in our bodies, not surprisingly, because they help create life. They are exquisitely sensitive to stress, alcohol, tobacco, toxins in our environment. And this is not woo-woo, this is based on real science and research that's out there. And one of the things I found fascinating, Elizabeth, when I was doing research for this book was the involvement of adverse childhood events. So we're looking at a joint study that was done by Kaiser Permanente and the CDC. Anyone that's listening can go online. I can take a short quiz. It'll give you a score. And the higher your ACE score, the more likely you are to experience more autoimmune conditions, more disordered relationships with food, elevation of risk for certain cardiovascular disease, as well as cancer risk. And interestingly enough, if you think about the fact that chronic stress rewires our autonomic nervous system. So we have the parasympathetic and the sympathetic nervous system. I think most people have heard of the sympathetic nervous system. It's fight, flight, flee, or fawn versus parasympathetic. So rest and repose. This is when you're supposed to be doing when you're eating, when you're relaxed, when you're sleeping. But most of us in our kind of harried modern day lifestyles tend to be sympathetic dominant because we're going all the time. In fact, when I was still working in traditional allopathic medicine, I would oftentimes eat and dictate at the same time. So you can imagine not optimal for digestion, but when we're sympathetic dominant all the time, when we're standing, when we're eating, we're standing in our, we're eating at our desk, we're eating in our car, we're yelling at our kids or eating off their plates and standing, not an optimal way to digest food. But to give everyone some context, so if our autonomic nervous system gets rewired, people that have experienced significant childhood stress, and it's, I think most of us are aware of big T trauma. We're talking about rape, murder, suicide. No one will argue that those can imprint us significantly, but the kind of corrosive little T trauma, neglect, addiction, abuse, those things, bullying can imprint us quite significantly. So thinking about someone who has a high ACE score, kind of gets to their teens, 20s, 30s, and we all have adaptive patterns. I think that for most of us that are high achieving, successful individuals, there are probably adaptive patterns we have learned to be able to subjugate emotions, move forward, be successful. Perimenopause is when, for a lot of women, it's a litmus test of how well we take care of ourselves. That chronic stress and how it has rewired our nervous system really starts to unravel in perimenopause in the setting of less hormones. So hormones like progesterone. Progesterone is instrumental for an inhibitory neurotransmitter called GABA, main inhibitory neurotransmitter. Estradiol, main form of estrogen our bodies make, is instrumental for serotonin and dopamine signaling. These are really important neurotransmitters. So as hormones are declining or they're in, imbalanced ratios, we will start seeing more mood disorders. We can start seeing people who their coping skills that were once adaptive become maladaptive. And what's been interesting is looking at the research, women that are under significant long-term chronic stress. There was one study done looking at a woman or women that had been sexually abused as children, going on to have offspring that were sexually abused, would actually go into menopause 8 years earlier. What I see clinically is that a lot of women with high ACE scores are going into menopause earlier. So let's define what's normal. Normal average age of menopause here in the United States is 51. Early menopause is kind of identified as before 45, and premature is before 40. So to give everyone some sense, so you can be between 45 and 55, and that's considered normal on a distribution curve. But helpful for people to have context. If you're going into menopause 8 years earlier, that's 8 years less that you have the protective effects of hormones. So I bring this up just to kind of provide some context because I have a lot of patients, many women going in at 46, 47, 48. It means their bodies are going longer without the beneficial effects of hormones, and why the conversation around what is the net impact of a decline in hormones over time. It's not just osteoporosis, heart disease, and brain health issues. It also is changes in the microbiome. So from my perspective, understanding that that complex interplay, chronic stress over time can be catabolic, so it'll break down muscle. It will change your immune system, so you're more susceptible to opportunistic infections. It's also why we see that women will develop more autoimmune conditions in the setting of declining hormones in middle age. So 4 to 5 times more likely to be diagnosed with celiac, rheumatoid, Hashimoto's, etc. Helpful for women to know that it has a lot to do with how the immune system interfaces with these hormones and how the, kind of the distribution of cortisol over time can lead to more leaky gut. And I remind women that leaky gut is what, opens up these tight junctions. Estrogen is really important. If we think of it as the brick and mortar between our small intestinal lining layer, we leak food particles into the bloodstream or endotoxin or any number of inflammatory substances. It provokes an immune response and can trigger symptoms. So giving women a sense of how stress and even adverse childhood events will impact the immune system. The other thing that I think is really interesting is that chronic stress begets higher blood glucose. Higher blood glucose means your fasting insulin is also going up. So women will talk about body composition changes, not just the menopause belly that many women really hate and despise, but alterations in body composition, less muscle mass, more inflammatory, oftentimes visceral fat or subcutaneous fat. For a lot of women, the body composition changes in midlife are a source of major, major pain points.
Yes, yes. I'm going to say I've seen that myself in my own postmenopausal life. That sounds very familiar, unfortunately. So, what can you do with your gut to change all of this?
Well, I mean, at a very basic level, the research certainly demonstrates that, interventions like high quality sleep. So we're not talking about 4 or 5 hours a night of sleep. We know sleep becomes incredibly foundational. So it's sleep hygiene, it's making sure you're getting 7 to 8 hours a night of sleep. You lean into the lifestyle piece first and then layering in hormone replacement therapy because we know progesterone, especially when taken orally, will upregulate a metabolite called allopregnanolone that can be very sedating, can help with falling asleep. Estradiol can be very helpful for staying asleep, along with the sleep hygiene. Managing stress. I always say, show me a woman who doesn't sleep and show me a woman who doesn't manage her stress. We become much less stress resilient without as much circulating hormones. So women may find that, great example is this book. I've been doing press for this book for 5 months. And I can tell you that, there were definitely peaks and valleys of super stressful weeks, less stressful weeks, the extra things that we have to do to manage our stress. Because as I've already mentioned, cortisol can be very caustic and corrosive to our bodies if it's elevated over time. So this may mean that your connection to nature, grounding work, breath work, meditation, vagal training. So gargling, humming, singing, all of which can stimulate the vagus nerve, which can help you get out of that fight or flight sort of the autonomic nervous system. Nutrition becomes very important, anti-inflammatory nutrition. I'm a proponent of protein-centric diets, preferably animal-based protein because the carbohydrate load from most plant-based proteins is going to put women at a disadvantage. So no less than 100 grams of protein a day. no more than 30 grams of carbohydrate per meal. And this is where it gets a little tricky because for my patients who are very physically active, very metabolically healthy, they can get away with more carbohydrate than someone who's not metabolically healthy, insulin resistant, or even diabetic. And fiber is an important part of that carbohydrate piece. So fiber becomes much more important when we're talking about navigating the microbiome changes in middle age. So for my carnivore people that tell me, fiber is irrelevant, then they don't understand the science of what actually is changing. As short chain fatty acid production goes down, fiber becomes a more important part of the conversation. Obviously, exercise is really important, but it's very much the Goldilocks effect. Strength training becomes important, zone two training, flexibility work, but it's the right amount of exercise at the right time. And, the question is always, is intermittent fasting good for me in middle age? It really depends on your stress levels, your sleep, your stress management. For my patients who are obese, overweight, not metabolically healthy, a degree of compression of a feeding window can be incredibly helpful. For my
Mhm.
very lean, athletic women, we want to get to a point where we're not undernourishing our bodies. And unfortunately, there's been this kind of prevailing theme of less is more or more is more. So if a little bit of fasting is good, more is better. If a little bit of exercise is good, more is better. More often than not, in middle age, we have to learn how to we have to work out not necessarily harder, but smarter. So I think that that's a prevailing theme. And then just thinking diligently about the trauma piece. So one thing that has really become apparent to me as I've, done over 100 podcast interviews for the book, done a lot of travel, is that for a lot of women that get to that middle age point, if they have significant underlying childhood trauma, they're going to have to deal with it proactively. It's not something you can subjugate. It is actually something that you want to work through and move through. In addition to that, I would say, things like hormone replacement therapy become really important. There's not yet a clinical indication for microbiome support, but certainly if you look at the research on what the gut microbiome looks like prior to perimenopause and menopause versus menopause on someone not taking HRT, providing estradiol therapy and progesterone will reestablish some of the diversity, reductions in inflammation that you see with younger microbiomes. And it's not something you can see. Really, the gut microbiome or any microbiome, oral, lung, vaginal microbiomes are not things we can see per se. They become these invisible organs, but we acknowledge that there are more of them than human cells in the body. But it becomes really important. You just understand that things like using mouthwash is a great way to destroy the oral microbiome. We know that the vaginal microbiome takes a huge hit in menopause, and so restoration of the vaginal microbiome with vaginal. I've been talking a lot today with vaginal estradiol therapy plus or minus DHEA or testosterone can be very, very helpful for not only decreasing our likelihood of pelvic floor issues, decreasing our likelihood of urinary tract infections, as well as, looking comprehensively at, maintaining the structural integrity of the vagina so that, middle-aged and older adults are able to continue having sexual intercourse without pain or issues.
It's been amazing to me that as I've learned about pelvic floor physical therapy, that this is not the standard of care in our
Mm.
country. After you give birth, it's all about the baby. The mother's kind of pushed aside and
Mhm.
assumed that, oh, her organs will go back to the way they were and she'll be fine. But meanwhile, that's not actually what's happening.
Yeah, and it's interesting because the standard of care in Europe is that women get referred to pelvic floor therapy immediately after they give birth, whether it's vaginally or a C-section. And here, I feel like I see a lot of patients in midlife that suddenly are like, I don't want to be incontinent. I don't want to have issues with being able to do jumping jacks or being able to run, or I have urge incontinence. Like I put my key in the door, and if I have to empty my bladder, I start urinating on myself. And so, pelvic floor support really is something that should be a foundational element not just for younger women, but also for older women as well. In fact, I went through a pelvic floor evaluation and it was interesting to see. I had two big babies. I was not a gestational diabetic, but given the fact I'm 5'3", I had two very big kids that were both breech. So I had two
Oh,
C-sections. And I recall that a GYN said, oh, well, you're never going to have pelvic floor issues. And actually, that's incorrect. You don't have to
oh,
push a baby out of your vagina. to have pelvic floor issues because over the course of, 40 weeks or 39 weeks, I had one that was 39 weeks, one that was 40 weeks. Your body is trying to acclimate a load that is displacing, your core muscles, your pelvic floor muscles. And so I think for a lot of women, they're surprised to know that pelvic floor therapy is something that is generally covered by insurance and generally can make a big difference in quality of life metrics.
Not even to forget to mention the adhesions that come from having that C-section surgery from where the scar heals. Those, I might not be saying this correctly medically, but as the tissue knits itself back together, it can adhere to your uterus, to other places inside your body where really it shouldn't be. And that can pull on your whole musculature and put off your gait. It can put off your posture. It can do all sorts of things without having that appropriate pelvic floor therapy to help release those adhesions so that your body can move freely the way it wants to.
Yeah, and it's interesting. I recall asking my my OB at the time, I was like, how do we decrease the likelihood of having adhesions? And she was saying, what they knew at that time, I have a 20-year-old and 18-year-old, was that you start um, first of all, you don't let women precipitously labor for far too long, that you're proactive about not, you don't want them to run a fever, you don't want them to need antibiotics. So she was saying like making decisions quicker rather than just waiting for people to labor over time. My OBs were never a fan of letting women go to 41 weeks, 42 weeks, and certainly not of women just having protracted labors, not to push a C-section, but just being really proactive about the labor process.
Let's go back to what you were talking about a few minutes ago, where you're saying our microbiome is affected by whether we were a C-section baby ourselves, whether we were bottle fed or breastfed. How can you talk a little bit more about that?
Yeah, I mean, when someone goes through the process of a vaginal delivery, they're getting exposure to the mother's microbiome just through the delivery process. Now, I know that, when I delivered my boys 20 and 18 years ago, they weren't as proactive about saying, okay, we're going to take some secretions from the vaginal microbiome and we're going to put them on the newborn, and that's going to help seed them. Now, I look at it as we have control over some things and not others. Now, I had two very large breech pregnancies, so I never beat myself up about not having vaginal deliveries, but both my kids were breastfed for more than a year. So I think that, we look at it as there are things we can change, there are things we cannot change. I think this is where nutrition and lifestyle, my kids played in the dirt. I had boys. I was not over sterilizing things. They ate a lot of nutrient dense whole foods, very little processed foods. So I think even if you don't get the most advantageous first start, the message should never be that somehow, your children aren't going to grow up healthy. I can look at my kids now being incredibly athletic, healthy weight, really smart, that clearly they were imprinted with plenty of things. So I never want the message to be, oh, shame on you, you had a C-section and you had a formula-fed baby. That's irrelevant at this point, but it's the actual seeding of the vaginal delivery that's so helpful. And we know that breast milk is more akin to what people, well, infants need over time. But again, I acknowledge that I have plenty of colleagues and friends that weren't able to do that. So I don't want it to ever sound like judgment. We do the best that we can with what we can. But that's why I think the other lifestyle choices that we make become really important and readily, become a larger conversation for us to have. In terms of education, I always had great pediatricians that were open to kind of fine tuning and tailoring things based on, what I thought was best and felt very supported. And by that, I'm not suggesting not vaccinating or anything like that. That's a very personal choice, but we're open and responsive to like not throwing antibiotics at everything. It's very common nowadays that a lot of pediatric practices, because of pressure from parents, are prescribing antibiotics for every, viral infection that's there, like every ear infection and every throat infection. And certainly
Mhm.
when it's bacterial, there may be an indication, but I think a tincture of time sometimes is beneficial for kids.
I like that phrase, a tincture of time. That works pretty well. So, as a midlife woman in perimenopause or menopause, what would be the best way to go about augmenting my own microbiome?
Yeah, I mean, I think it's really starting with the basics. We know the research on circadian biology suggests that sleep becomes very important, not eating too close to bedtime, eating 30 plant varieties a week. So obviously the fiber piece is important, but getting diversity into our diets is really important. Obviously, managing stress, easier said than done. I don't know any middle-aged women that have no stress. But obviously trying to augment as much as you can. So sometimes it's having healthier boundaries and learning how to say no. I have a family member right now that I'm on no contact with, and that was a tough decision to make, but it's been great for my mental health. But when I think about when I'm talking to women, again, it goes back to, the sleep piece, the stress management, the nutrition. And I think nutrition is one of the most powerful levers that we have. I think for many women, it's discovering that otherwise healthy foods, whether maybe it's grains, maybe it's dairy, maybe it's, well, alcohol, I don't consider healthy, but alcohol, maybe it's sugar. Some of these foods that, seem like they are such a large part of our culture no longer agree with us. And so really dialing in on inflammation. There are very few women I know in middle age that can eat the way they did at 18. And so sometimes those big, gluten, grains, dairy, alcohol, sugar, become a larger piece of the puzzle to really, see how they do with elimination, looking at the meal frequency piece, looking at alcohol. Alcohol is a toxin. It is a known carcinogen. It does diffuse across the small intestinal lining. Women, because we have more body fat than men, it hits us harder. There are no known benefits to alcohol consumption at this time. When I finished my nurse practitioner program in the early 2000s, we felt differently, but the research is certainly suggesting now, but the alcohol lobby does a great job convincing us otherwise. So I always say everything in, if you're choosing to drink, save it for that celebration, save it for an anniversary or a birthday, do it sparingly or rarely, or even, being completely alcohol abstinence, I think is all going to be better for our physiology long term. And the other thing that it really comes down to is when we're thinking about, nutrition and what's of greatest value, it's fermented foods, probiotic rich foods. Before you reach for a supplement, get really granular about what you can add to your diet. I think that can be very powerful.
Yes, probiotic rich foods better than supplements. And the supplements in many times are full of additives and things that might be causing more inflammation in your body. They might be grown on lactose. A lot of them are milk based, and if you have a milk problem to begin with, then that can make you more inflamed than and not do what you're trying to do for that microbiome. Let's go back to the ovaries, which I find absolutely fascinating. When I saw my gynecologist about a decade ago, she said, "Oh, your ovaries are very old. They're getting all shriveled up." And I thought from everything that I had learned growing up that that meant my ovaries were dead. But I learned recently, actually, from another guest on this podcast, Dr. Susan Fox, who's a fertility expert, that your ovaries are still communicating with your body and doing vital functions for your entire life, whether or not you're menopausal. What can you tell us about those ovaries and that ovary microbiome you mentioned?
Yeah, I mean, I am certainly not a fertility expert and I'm not an ovarian expert, but from the research that I did, it talks about this complex interplay between the gut and our ovaries, that there is this gut ovarian axis and how inputs for the microbiome can communicate with the ovaries. So if you are smoking, drinking excessively, dealing with a lot of chronic stress, that can prematurely age, there's this atresia, can prematurely age those ovaries. And it is correct. I mean, even in menopause, we still have eggs, but they're not like the A plus eggs. They're the kind of backup quarterback eggs that probably would not have gone on to be able to be fertilized or have a viable pregnancy. And so it's helpful for women to understand that we are born with a finite amount of eggs. Unlike men who are replenishing sperm on a daily basis, women are not like that. So we get, a big drop off at puberty, we get another big drop off at like 35, and that's why it becomes oftentimes more challenging to get pregnant as we get older. But in terms of inputs from the microbiome, the health of the microbiome is intricately interwoven with the health of the ovaries. So if you are physically sedentary, not metabolically healthy, not exercising, not sleeping well, not managing your stress, you're going to age your ovaries faster than someone that's having an opposite lifestyle. So I think that fertility is a biomarker for overall longevity and health. And in many instances, we think very differently about ovarian function now than we did even when I was in my medical training, that we acknowledge that, for a lot of individuals, unlike men who can procreate till the day they die, women end up needing some degree of technology to be able to do so, whether it's donor eggs or IVF or other such things. But I think for a lot of women, they're surprised to know that our ovaries really are like the canary in the coal mine. I think for many people, infertility is now, exploding. There's a lot of things that are contributing, not the least of which an unhealthy microbiome, vis-a-vis that bidirectional relationship. So if you have a microbiome that has healthy diversity, a fairly reduced level of inflammation, you're able to make great short chain fatty acids. Your inputs are that you manage your stress and you sleep well. Your ovaries are going to be healthier than someone who has polycystic ovarian syndrome and someone who is not metabolically healthy. So I look at it as there's more labs that are available to young women now than what we had when I was, in that stage of my life. And so there's really interesting and compelling research that's coming out about ovarian aging and how we can, I don't want to use the word hack it, but how we can, proactively, prolong like the amount of time it takes for women to go into menopause, as opposed to it's just something that happens. It's completely arbitrary. I think now we acknowledge the influences of certain inputs on ovarian function long term.
I feel like this has been a field of medicine that has been absolutely ignored completely, maybe throughout the history of modern medicine. So it's good to hear that there is this connection that we never knew about, but that we can be aware of and that we can actually do something about to help ourselves. Which leads me into let's talk about inflammaging, as you mentioned before. What does that mean? Can you define it? Can you talk about how it happens and what we can do about it?
Yeah, I mean, it all goes back to lifestyle. So obviously, when we're talking about immunosenescence, aging of the immune system, which goes right along with this inflammaging, it is at the basis of aging is inflammation. And it's chronic inflammation that leads to a lot of these long-term poor health outcomes, cardiovascular disease, neurocognitive decline, poor bone health, poor microbiome health. And the inputs are exactly what we talked about. I always say major in the majors: poor quality sleep, poor stress management, ultra processed foods, eating too frequently, being physically sedentary, the influence of trauma and unresolved childhood adverse events are all things that we know are incredibly impactful on not only the immune system, but inflammation at large. And I think for a lot of people, they'll say, well, menopause is normal. Yes, if we live long enough, we will all go into menopause. All men will go into andropause. Um, but there are choices about how do we live optimally. And so if we want to live optimally, we need to be proactive about the things that we know are anti-inflammatory. As I've mentioned over and over, there's these common themes, and we have to live differently than the average person. And it doesn't mean that it necessarily has to be costly or expensive, but we need to eat less processed food. We need to not drink alcohol. We need to move our bodies. We need to manage our stress. We need to sleep. We need to be mindful about fiber. We need to be mindful about ferments. All of these things are known based on research are going to help reduce inflammation in the body, along with HRT. I think for a lot of people, they'll say, well, I don't want to be on HRT. It's not natural. And I'm like, well, so is living without hormones. Up until, 100 years ago, people didn't live as long as they do now. But now women tend to live longer than men, but they have a decade of marginality. So the marginal decade of poor quality health is what has become normal for most women. They're not out there running marathons or 5Ks. They've got a wheelchair, or they've got a walker, or they've got a cane, or they've fragility fractures, neurocognitive decline. For a lot of them, they develop, atypical chest pain and have cardiovascular disease, which 1 in 3 women will die of heart disease. So not to mention the other sequelae that come from poor metabolic health. So from my perspective, it's really looking kind of persuasively and talking to patients about how are they choosing to live their lifestyles and helping educate them about how replenishing hormones can be part of turning back that biological clock, not so that we're menstruating again, not so that we're fertile, but helping them, improve their brain health, improve their constituency of their microbiome, and reduce their cardiovascular disease risk, improve their bone health risks. I think for a lot of people, they assume that bone health is just about a decline in estrogen. And I remind them that changes in the microbiome impact bone health. So things like a reduction in short chain fatty acids actually will destabilize osteoclastic activity. So this bone breakdown and the bone buildup are designed to be in balance. And what happens in menopause and the setting of less hormones is they get more bone breakdown to bone balancing. And so helping people understand how all these things intersect with one another.
So instead of just supplementing with calcium for your bones, we're
Not a
looking
good
at the
intervention.
entire, right? That's not a good idea.
No, no, and it's actually, I mean, I did a video on this on YouTube of supplements that aren't worth your time, and actually calcium is one of those that get your calcium from food. Actually, taking it supplementally can be more problematic than beneficial.
Right. It can create stones, it can create all kinds of issues. And certainly
Calcification.
calcium needs many factors to actually get into your bones. Just pure calcium isn't absorbed by the bones. So, yes, doesn't make any sense. There was something I wanted to ask you about. What was it? It was, um, oh, it's going to come to me. Something you said triggered something in my mind. But I think that this is all just really revolutionary in many ways for women as we join. Oh, I wanted to mention to any listeners who weren't sure what HRT is, that is hormone replacement therapy. It was demonized back 20 years ago or so, but that study that linked it to breast cancer, I think, right, has
Yes.
been debunked.
Well, and I think, you're talking about the Women's Health Initiative that was published in 2002, and I was a new nurse practitioner, and it was looking at two different arms. One was they're both with synthetic hormones. It was a study, participants were older. They were more than 10 years into menopause. Many of them were obese, previous smokers. They were already not metabolically healthy. So you're not starting with a healthy population.
Mm,
But there was one arm that looked at conjugated equine estrogen, which is synthetic estrogen. There was another
right.
arm that looked at conjugated equine estrogen and progestins, which again, not bioidentical in either arm of the study. And yes, there was some concern that in the dual arm of progestin and conjugated equine estrogen, that there were some increases in specific types of cancer. And so from that early study recommendations were that, just avoid prescribing hormones, which unfortunately, there was a whole generation of clinicians that were fearful to prescribe hormones, and a whole generation of women, my mother's generation, the boomers, that were fearful to take hormones. And so we really now have a case study of what happens if women are not taking hormone replacement therapy. And so I'm obviously very pro HRT. I like all patients to be able to have an educated discussion with a licensed prescriber. This is really important. Do not let the person online that has no ability to prescribe medications tell you or fearmonger you. Usually it's a gym bro or a chiropractor or someone who has a doctorate in something that does not allow them to prescribe. They're not a medical doctor, they're not medically trained. And it's a source of endless irritation for me and my team because I'm like, time out. Let's make sure that the prescribers are having conversations with their patients because ultimately it's an informed conversation. It is taking what the patient's goals are, and it's the provider, prescriber sitting down and giving them pros and cons of all choices. And then it's up to the individual. Now, can women say, 5 years into menopause, I don't want to take HRT, and then 5 years later decide they do? Yes, but you have a degree of risk stratification that you have to look at. The longer you go without estrogen, the more inflammation that's going on, especially at a cellular level, especially with the endothelium. So obviously my background's in cardiology, and so I remind women all the time, the longer you go without estrogen, the more inflammation and heart and plaquing that you can have in the interior part of your arteries. So looking at things like CT angios, looking at carotid intimal thickening, looking at specific labs to assess the risk of cardiovascular disease, because what kills most of us is not hard plaque. So there's something called a coronary artery calcification or a CAC. Everyone's doing these studies, and yes, they have some benefits, but it's looking at hard plaque. What's most concerning is soft plaque. That's the stuff that breaks off and occludes arteries. So I always remind women, I just want you to be informed. And so in terms of diagnostics, CT angio is going to be superior.
What do you think about the whole cholesterol thing and statins for women?
If you look at the Jupiter study from 2016, women that take statin therapy, and this is not medical advice, if you are taking a statin, do not stop. The Jupiter study essentially provides information suggestive of women are much more likely to develop diabetes if they take statins than men. We know
Hmm.
that it changes things at a cellular level and especially in the microbiome. And so I think that if you're prescribed a statin, again, not telling you to stop it, have a conversation. But if someone has heart disease and diabetes and they're not metabolically healthy, and they've just had a recent heart attack or a stroke, a statin is going to be indicated. We know that they can be anti-inflammatory. We know they have these pleiotropic effects, but it has to be made in the context of a larger conversation because there's no statin that's out there that doesn't cross the blood-brain barrier. This is important because a lot of people, a lot of my patients would talk about how some of them had some neurocognitive effects, some of them just felt like they weren't as clear mentally. And it has a lot to do
Hmm.
with it decreases the cholesterol in the brain. It's not just a peripheral conversion of cholesterol. So something to definitely think about. But unfortunately, most traditional allopathic providers are hitting everything with high cholesterol with the hammer of statins, when in essence, we have to look at what's your HDL to LDL, excuse me, your HDL to triglyceride ratio. I like to see triglycerides below 70. If you look at a traditional like lab, they want you on 150. You're already insulin resistant if your triglycerides are 150. We want HDL for women greater than 45, ideally greater than 55. Your LDL, if that's high, that doesn't tell us a ton. It probably also corresponds to other risk factors. So I think for a lot of individuals, it's a larger conversation, a much more nuanced conversation. It's looking at things like ApoB, LP little a. It's looking at those diagnostics to get a better sense. But anyone that's prescribing statins solely for high total cholesterol, I would run.
That's so refreshing to hear because I just see statins, as you said, prescribed kind of willy-nilly, like, oh, well, you're over 50, you should be on a statin. And I see a lot of side effects of statins, of inflammation, even localized inflammation. I remember I had an uncle at a family event one time, and he had changed his statin, and his one forearm was swollen so big he couldn't fit his watch around it. So
Hmm.
it was a weird reaction, and I thought, it's not going to kill you to stop taking the statin and see if the swelling goes down, but the
Well, it's
statin
probably
that you're on might kill you.
Yeah, I mean, I think the biggest message is there is a clinical indication for statin therapy in specific circumstances. The message is not to stop your statin, it's to have a conversation with your prescriber. There are other medications that can be helpful. I'll give you some examples. There's a blood test called the cholesterol balance test that's usually it's by Boston Heart, very inexpensive. It can tell you if you are a hyperabsorber of cholesterol or a hypersynthesizer. Let me be
Mhm.
really clear. If you have an affinity for absorbing cholesterol, taking a statin will not help you. Full stop. If you make too much cholesterol, then a statin would be indicated, but again, not medical advice, but these labs can be particularly helpful for fine-tuning things. There's a drug called ezetimibe or Zetia that is helpful for people that hyperabsorb cholesterol. It acts at the small intestinal lining. It's not a systemically absorbed drug. And for a lot of patients, that can be very effective. It's also dirt cheap. I am old enough that when that drug came out, it was quite expensive. And so I would just give my patients samples. But with that being said, there's more to lipid management than hitting everything with a hammer and the hammer being a statin.
That brings up, let's talk a little bit about that kind of edema and generalized swelling that a lot of middle-aged women fight with. And then I want to talk more about what's in your book before we wrap up.
Yeah, so most swelling in the legs is a byproduct of venous insufficiency, meaning the valves in your veins are no longer competent. And when you keep things in a dependent position, like you take a long plane ride, you're sitting on a bus, sitting in a car, you might have some mild swelling when you get up. That is generally related to venous insufficiency. Now, the word edema is the word for swelling in medicine. Now, edema can be mimicked by a lot of things. For some people, it can be benign and it could also be significant. So I always say if you are having a lot of consistent swelling in your lower extremities, your arms, your legs, that needs to be evaluated. There are cardiovascular reasons why this happens. For a lot of my patients, they had to wear things like TED hose for venous insufficiency that would help with blood return back to the heart. A lot of my patients who had heart failure had a lot of swelling in their peripheral arms and legs, and again, worsened by peripheral edema. There's other reasons why this can happen. If it's in one leg and not the other, I start thinking about a blood clot or a Baker's cyst, two very different things. One is serious, one is not. The greatest concern is if you have unilateral swelling, like swelling in one leg, you need to make sure you don't have a blood clot because that can embolize to your lungs and can kill you. And I don't say that to frighten anyone. I just say it like there are some big themes that I think are important to think about, always in the context of you said, I just took a 20-hour flight back from Asia and I suddenly have swelling in one leg. That is different than every time grandma sits in this chair for more than an hour, she gets swelling in her legs. That's probably venous insufficiency. So very, very different. We used to tell patients all the time, like, be careful of your salt intake because sometimes that can worsen things. It's really not the salt, it's the processed food. So being cognizant of limiting your intake of processed foods, I think is really important. So kind of key themes. In terms of the book walks you through what the microbiome is. I talk about this romantic trip I went on with my husband to Morocco and how one of us got sick and one did not. My sickness ultimately led to a 13-day hospitalization in 2019. I did my second TED Talk with a ruptured appendix. Fun fact, I'm sure I'm probably the only one that ever has. But through the course of the book, I talk about the microbiome. I talk about ovarian senescence, which is the aging of the ovaries. I talk about immunosenescence, which is aging of the immune system. I go into deep details on why, if you have poor quality bone, it is very likely worsened by poor quality gut health. So the gut microbiome and the bones work together. I walk you through like really focusing in on measuring in the majors: sleep, stress management, nutrition, exercise. We spend a lot of time talking about stress and trauma. We walk you through HRT as well as supplements, like targeted supplements. And then there are recipes in the book that are probiotic, protein centric, so really delicious recipes. I was able to collaborate again with Beth Lipton, who's just brilliant with recipe creation. And it's really a labor of love. This is the book I wish I had 10 years ago, but didn't. I think it's the missing piece of the puzzle because so many women are conditioned to believe that all you need is an estrogen patch and all of your woes will go away. This is a more nuanced conversation that dovetails nicely into the existing perimenopause and menopause books that are out there.
Oh, it really just feels like, as you said, like the missing link. This is something that everyone should have. It should be maybe a textbook in medical schools, even. Where can people find the book?
Yeah, so the book is on sale in pre-sale right now. It will be in full publication on April 28th, so 2 weeks from today. You can find it anywhere where fine retailers, Amazon, Barnes and Noble, Books a Million, Target, et cetera, et cetera. I always say if you have a brick and mortar business in your area, you definitely want to ensure that you are giving them your business. I always say since the pandemic, I'm particularly my heart goes out to brick and mortar retailers because in many ways the online environment has just taken away a lot of their business. I'm active across social media. If you go to my website, you can actually get some of the pre-sale bonuses, which will be available until May 5th, and include things you actually want that will help improve the quality of what you're reading from the book and be able to have some applicability. I always say, like, I polled my audience before we created content just to make sure it'd be helpful. I have a podcast called Everyday Wellness where I get to interview the best and the brightest in the health and wellness industry. And I'm probably most active on Instagram. I have a new affinity for Substack. So if you like to read things in greater detail, that's a great way to learn more about the microbiome and topics that we've discussed today. And, if you end up purchasing the book, please let us know. It's the things that I've been hearing from physicians and researchers that have read the book. They're like, it's groundbreaking. It's one of those books that's really going to have a lot of impact. And ultimately, that's why I wrote it.
Not only that, but you do have some in-person, in real life events coming up. I assume that people can find those out on your website.
Absolutely. Absolutely. So we've got in-person events upcoming in DC, Miami, Denver. We've got, it sounds like we've got things developing in Dallas and a few other places. But yes, if you go to my website, you can look at, we have a web page that's kind of getting updated fairly frequently just so that we can send people to specific locations.
And that website is cynthiathurlow.com
Correct.
for our listeners. It will also be in the show notes. Cynthia, thank you so much. Is there anything that you'd like to leave our listeners with if they're currently in perimenopause or menopause?
Oh, I would say trust your gut. And I say that from a literal and figurative perspective. The little small changes that we make day to day can help imprint the gut microbiome in beneficial ways. The big takeaway is there's always things that we can do, even if you've been a couch potato eating standard American diet, not managing your stress and not sleeping. Trust me, there are little things that you can be changing about your lifestyle that will have a positive net impact on the microbiome long term.
Thank you. I think this is such important information, and I cannot wait for your book to come out so that everyone can read for themselves what you're talking about, because this is really just something new that we're not aware of or haven't been aware of. Our mothers and our grandmothers didn't have the benefit of this information, and I think it can be incredibly life-changing, and we should all be aware of it. And there's so much in there that you can do yourself at home without even seeing a doctor or getting a prescription or paying a lot of money to do anything like that. So thank you so much for
Thank-
putting out this book.
Thanks for having me, Elizabeth. It's been a pleasure.
It's pleasure is all mine. And that's another case filed on the Inflammation Investigator. Remember, every symptom is your body's way of communicating. We just need to learn the language. If today's episode sparked something for you, I want to hear about it. Share your own investigation discoveries with me on social media at Elizabeth Yarnell, or find me at elizabethyarnell.com. Your experience could be exactly what another listener needs to hear. And make sure you're subscribed so you never miss an episode. And here's the thing about investigations: they work best when you're not going it alone. If this podcast is helping you uncover the answers you've been searching for, please like, rate, subscribe, and review, and share it with someone who needs to hear this message. As a new podcast, these actions mean more than you know. Want to dive deeper into your own inflammation investigation? Head over to inflammationinvestigator.com, where you can take my free inflammation quiz to uncover which hidden triggers might be affecting your health. Until next time, this is Elizabeth Yarnell, your inflammation investigator, reminding you that the solutions to your health issues are out there. Let's find them together.